So what are the difference between rheumatoid and osteoarthritis types? So osteoarthritis is the wear and tear type of arthritis. Rheumatoid arthritis is where your body attacks itself. Now, one would think that rheumatoid was a genetic condition and osteoarthritis was not, but it's actually the opposite. Osteoarthritis is passed on genetically, and your parents give you the predisposition to wear out your joints faster. Whereas rheumatoid arthritis is technically a genetic defect or a defect where you are predisposed with the way you're made for your body to attack itself. It's called an inflammatory arthritis. And so the ways to treat these are very different. For osteoarthritis, we just treat the symptoms. We know that we can't affect it very much in terms of, as we said earlier, things that we may or may not do because genetics play such a big role. Whereas rheumatoid arthritis, rheumatologists and orthopedic surgeons alike can give you medicines to decrease your immune system from attacking yourself. Now, once you reach the end of the road or bone-on-bone arthritis, they're treated the same. The treatment is shots and pills and therapy, and then eventually a knee or hip replacement. And so recognizing the type of arthritis early on especially can play a role in you preventing problems, especially on the rheumatoid side.